My name is Leanne Boetel, and I'm a co-responder that's employed through Sherburne County Health and Human Services.
I'm Roy Neumann. I'm a co-responder through Sherburne County Health and Human Services.
Responding to 911 calls for mental health crisis, substance use, homelessness. When we're not doing that, we're connecting those individuals with resources, services that they might need to have long-term, and also conducting follow-up calls with them too.
Well, I've been looking for this career, my whole career actually. When I got out of grad school in '99, I was looking for a job that would marry law enforcement and mental health. So when this opportunity came up, it was a natural fit for me. I had almost 20 years as a reserve deputy in law enforcement already. So when I found this opportunity that blended law enforcement and mental health together, thought I had to jump at it. I think one of the quotes from one of my favorite movies anyway is in Top Gun Maverick, when he says, "It's not what I am, it's who I am." And I think it's important that a person in this role has that experience and that temperament and to do the job well.
In my previous employment, I worked a lot with people in mental health crisis, and I found a passion for that. I also found out that it was something that I was pretty good at, and so between those positions and this position, when it opened up, it was definitely something that I wanted to do, especially being in this part of the community, as I'm from the area. So I think that's really what brought me here.
There is no universal training for co-response. Our statutes don't mention co-responder anywhere. So what you'll see is that if you know one co-responder program, you know one co-responder program. We are all very good at looking at other programs and taking those lessons and making our own program. We did that here when we evolved from the St. Cloud program. They evolved from the Denver program. Even around Minnesota, we are representing about 130 jurisdictions throughout the state. Each one of those has their own program based loosely on a prototype program. So there's nothing specific to what we do that separates us out as a profession.
Being there for people when they're experiencing crisis, knowing how to kind of be that calm during the storm, and helping them get back to a baseline or where they can still stay at home, be safe at home, not end up being hospitalized, incarcerated, and then also filling those gaps between, that initial crisis and follow through on getting them what they need, the treatment they need, the mental health services that they might need, shelter, substance use treatment, what have you. I think that's probably my favorite part.
I think doing co-response is a specialized discipline, that it's not just something that any social worker or any therapist can just do. You might be the best at your job in what you're doing as a therapist or as a social worker, and you hit this job and you find out that it's not a good fit. My joke is that the co-response is you have to be the square peg in the round hole. You have to be able to do the clinical work. You have to be able to do you have to have clinical expertise. You have to have expertise in crisis de-escalation. You have to have expertise in resources like our social workers do. And you have to be able to fit into a law enforcement world and into a crisis world where you're going from one call to another, not knowing what you're walking into, and be adaptable and flexible. So I think one thing that people should know is that it's a specialized kind of a position.
Okay. I think the biggest thing is that if people are needing resources, services, or they're trying to just find some help for things that they're going through, the biggest thing would be to call Sherburne County Health and Human Services. If you're experiencing a crisis, never hesitate to call 911. They have a procedure on how they're going to triage that crisis you're experiencing, and it could be getting you over to a crisis line, it could be getting you over to law enforcement, or it could be a response with co-responders.